Mareks disease is a highly contagious disease of poultry. In acute cases, it causes lymphoproliferative disease, and in chronic cases, it causes peripheral nerve enlargement. The occurrence is worldwide. The visceral form of the disease is quite frequent, and the neurological form of the disease is quite rare. And due to widespread vaccines, the clinical signs have decreased. The etiology of the disease. So the alpha herpes virus has the Mardi virus genus, Gallid herpes virus 2 and Gallid herpes virus 3. Gallid herpes virus 2 has the serotype 1 and Gallid herpes virus 3 has the serotype 2. The Gallid herpes virus 2 is pathogenic with different virulent strains. The very virulent strains cause tumors, lymphoproliferative disease. It happens in birds under 6 weeks old that are not vaccinated. In the virulent strain, we can see transient paralysis. Recovery is rare, and we can also see tumors. It happens in birds from week 4 to 7 that are not vaccinated. It's virulent in chicken. In the lower virulent strain, we can see neurological symptoms. It affects growers and young birds, it's sporadic and it's long-lasting. And the avirulent strain is non-pathogenic. Gallid herpes virus 3 is non-pathogenic. It is used in vaccines. It is related to the turkey herpes virus, which is called melagrid herpes virus 1. Gallid herpes virus 2 is also related to the melagrid herpes virus 1. For the epidemiology, it mainly affects domestic fowl. They're mostly susceptible. It can affect turkey also. There's a highly virulent strain that can cause tumors. It is not a germinative infection, but infection can happen in hatcheries outside the egg. The virus is highly resistant, which is unique for herpes viruses because they're envenomed, which means they have low resistance. The virus can exist in infected feather follicles. It's an aerogenic infection and can happen through inhalation, and hens are the most susceptible. The pathogenesis of the disease, it's an aerogenic infection, happens through inhalation or through the feather follicles, and the primary replication happens in the respiratory epithelium in the macrophages. This then causes viremia after 2 to 3 weeks, and then the macrophages bring to the lymphoid organs, such as the thymus, spleen, and bursa. This then causes B-cell cytolysis, which leads to immunosuppression, and proliferation due to activation of the T-cell, and then T-cell cytolysis, which leads to long-lasting immunosuppression. In the proliferative phase, tumors develop and infected T-cells carry the virus. We can then see the clinical signs. There are free virions from the feather follicles when infected T-cells reach the skin, which causes skin lesions. It's cell-bound always, and there's no viral neutralization, which means there's no antibodies. In the clinical signs, it mainly affects birds that are 1 to 2 weeks old, and over 8 weeks old, it's a subclinical infection. The incubation period is acute for 6 weeks and chronic for 6 months. Per acute is around 3 to 6 weeks, which is rare. The acute visceral form, you can see anorexia, anemia, nodules on the skin, and the mortality is around 20 to 60%. In the classical neurological form, which is the chronic form, we can see weakness, ataxia, and one-sided paralysis in the leg or the wing. And in the pathology, we can see 2 forms, the acute visceral form and the classic neurological form. In the acute visceral form, we can see tumors in the ovary, the kidney, the spleen, the liver, the testicle, and they're enlarged. And we can see the feather follicle is also enlarged, and you can see bursa atrophy. In the classical neurological form, we can see enlargement of the plexus brachialis and the nervus ischiaticus and the idiositis, which is a grey eye. The diagnosis is virus isolation, a PCR, and an agid feather follicle. And MATSA should be done for tumor surface antigens. It's not very diagnostic though. The differential diagnosis is reticuloendotheliosis, it's in the lab, and avian leukosis. For prevention, follow the epidemiology rules, biosecurity, vaccination, and genetic resistance. For the vaccine, there's an attenuated serotype 1, which is Gallid herpes virus 2. Serotype 2, which is Gallid herpes virus 3, is not used alone. There's a HVT recombinant and other viruses are inserted. The vaccine is given at an 18-day-old embryo in the hatchery. It's an in ovo vaccination, or a day-old chick in hatching.